Patient 45-year-old presents in emergency with pain in the epigastrium and drowsiness for 2 days. No previous significant history was given. Now we scanning the epigastrium and abdomen of the patient. Here we see the left lobe of liver, which is echogenic. Here we see fluid or collection around the left lobe of liver. The patient is feeling pain or tenderness at epigastrium area. Here we see another hypoechoic area or fluid or collection. Now we will measure the volume of this collection. For that need 2 view or 3 dimensions, a transverse and oblique. The volume of this collection is 67 ml at epigastrium area or at left lobe of the liver. Now we scan the liver and gallbladder. Here the texture of liver is coarse. Now here we see the multiple stones in the gallbladder. Here we also see the pericholecystic collection. Now here we see the defect in the anterior gallbladder wall. It means the gallbladder wall is perforated from here. The gallbladder wall is thickened. Now we will measure the collectively size of these stones. When there is one or two stones, we can measure separately, but when there is multiple stones, then we will measure collectively size. The collective size of these stones are 62 millimeter. Here we see the thickness of gallbladder wall and pericholecystic fluid. Now we will measure the thickness of gallbladder wall. The wall thickness is 6.7 millimeter. It shows the gallbladder wall are inflamed. The normal gallbladder wall thickness is 3 millimeter. Here we see a defect in longitudinal view. The bile is leaked from this defect into pericholecystic area and in epigastrium. As we see, there is collection in the epigastrium area. The other walls of gallbladder are normal at fundal and posterior area. Here we also see right kidney, which is also normal. Now when we scan the pelvis, here we also see a collection of venous fluid in the pelvic area. Now how we will write report. Gallbladder contain multiple calculi, collectively measure 62 mm. Walls are thickened 6.7 mm. There is also a defect in the interior wall of the gallbladder and leakage of bile in the pericholecystic area. A debrinous fluid collection measuring volume 67 ml present in the epigastrium and around the left lobe of the liver. The left lobe of liver shows heterogeneous structure, mainly increased echogenicity. It may be due to inflammation of infective collection. The right lobe is coarse and pancreas is normal in size and shows increased echogenicity. Minimal debrinous fluid collection also present in the pelvis. The ultrasound diagnosis is cholecystitis with cholelithiasis and perforation of interior gallbladder wall with fluid collection in the pericholecystic area, epigastrium and around the left lobe of liver and pelvis. The patient is referred to surgeon for treatment.